Hello, thank you so much for your time today. My name is Brooke Fremouw. I'm a certified trauma support specialist specializing in adoptive families, and I'm also an adoptive mom to 11 incredible children. Thank you for joining us today. We're going to be talking about when help you feel like your child is a hypochondriac and every issue that they have, whether it's a little tiny poke on their finger or whether they're sick, have a stomach bug, claim ear infections, whatever it may be, but that your child seems to chronically be coming to you with pain or sickness. Have you had that happen? And are you raising a trauma kiddo or an adopted kiddo with adoption trauma? Because it's very, very common in our adoptive homes. Does that surprise you? I know I just had one of our moms from Journey University reach out to me today and say, I just feel like the more we're getting on top of body regulation, the more my child is coming to me claiming illness, demanding that I take her to the doctor for an ear infection, only to find out that there's absolutely nothing wrong. Claiming that her stomach hurts so bad, but then following me all around the house to whine and complain about her stomach issues. Does this sound like something that you've had going on? I know in my home, we've had some kids that were definitely hypersensitive to pain. So let's talk about the two primary reasons that our kids will come to us and claim pain or injury outside of an actual real issue. Okay, so let's set that aside. There are kids who are sick. There is definite illness that goes around. Pain is a very real factor. And so, of course, as parents, we want to rule out that there is a medical issue and trust in the fact that your child actually is healthy and stable and safe. So that's the first thing, right? But oftentimes, what we're talking about here is a kid who is claiming that their pain is a 10 out of 10, when in all reality, they're still capable of following you all around the house and eating their food and all of these things, but then whine and fuss as if they really are dying. And you as a parent are like, I don't want to neglect them, especially if they've had attachment issues with a biological family prior to you. Or if they've got trauma, you want to be validating, you want to be connected and caring. And so, what are you supposed to do? Well, the answer to that lies in what's really going on here. So if we look at the two primary causes, it'll lead us into the best ways to approach these issues. And so the first issue that we may be dealing with is a sensory integration disorder. If you have a child that was exposed to drugs or alcohol in utero, sensory integration disorders are extremely common. Trauma can also create sensory integration disorders as well as neglect. Kids who aren't getting the typical inputs early enough in life or that aren't being exposed to enough sensations just kind of left in a crib. So those can all be things that lead to a sensory integration disorder, but let's talk about what it is. There are two ways that sensory integration has shown up. I've had them both in my home, and most of my clients come with sensory integration disorders. How will you know? Well, one form of sensory integration disorder would be hypersensitive to touch. So sounds, tastes, textures, input, sensory input, they're going to be hyper in tune to that. You'll notice some kids with autism, right, are hypersensitive to the sensations that are around them. What is it? I want you to think about the brain and the signals that come from our skin and from our subconscious pressure. Right now, you're likely sitting down. You know that you're sitting down because there are subconscious signals that are coming from your tush to your brain that say you are seated and that you can sit still because gravity has got you, right? So think of that as a dial, and you and I may be set to normal where we're able to just sit in a chair and get those subconscious signals. Well, a kid that is hypersensitive, it may be uncomfortable for them. So that you might find them moving because, oh gosh, things just hurt. The seams in their pants, the textures of jeans. A lot of these kids, they want to wear leggings rather than jeans or shorts that don't touch their skin, right? These kids, oftentimes, they don't like to play in grass. They don't like the sensation of sand. They don't like mixed texture foods such as potato salad, right? Where you've got the onion crunch and the celery crunch, but you've got the soft of the potato and then the slime of the mayonnaise mixture. And so, if your child is struggling with hypersensitivity, they are likely hypersensitive to pain sensations as well. So, you've got to consider that if they have a headache, what you would feel as a 5, they are going to feel substantially more painful, right? Or something that pokes them. For you, it may just be a small poke. For them, that could send them through the roof because their neurological system isn't calibrated in a way that would be considered typical. The opposite of this can also be true. Hyposensitivity. Hyposensitivity is going to be some sensory seeking kids. Do you have a kid that's really rambunctious, that destroys toys and doesn't intend to, and is truly sad that their items are broken? They just tend to be very, very rough. Oftentimes, you will find that they are hyposensitive, meaning they don't get enough input. They're looking for that subconscious gravity to hold them into their seats. And so they're going to fidget for a completely different reason. They're looking for the input. These kids, they can be toe walkers or chronically running from place to place. They jump, they climb, they bite, right? They're looking for the inputs that you and I get both consciously and subconsciously because their dial is all the way down. These kids are going to present the opposite of hypochondriacs, and yet they also have a sensory integration disorder. If this sounds like a child that you have, stay tuned. We're going to get to what to do about it, okay? The second reason that your child may present like a hypochondriac when they genuinely don't seem to have anything that you would determine as being wrong is attention seeking. Now, this is a really, really common one in the world of adoption because the number one thing that adopted children want, I know, you think love, connectedness, they want that. They do. Oftentimes they don't know how to receive that. And it's not typically the thing that they want the most. The thing that they want the absolute most is control. Because control equals safety. Control equals the ability to navigate their environment and avoid further pain, avoid further trauma. And so if they are sick or they are in pain and they are attention seeking, it is a way for them to be able to captivate you, pull your attention, right? And feel like they're in charge of their environment and that they can get their needs met. And they're using you to do that. Is it manipulative? No, it's not a conscious behavior choice that they are making in most cases. For them, it's another way of survival, right? They are fighting for attention. They are fighting for affection. They are fighting to know that they are okay and that if they're not okay, you're going to be there to meet that need. And so ignoring them is not going to help. And yet, we don't want to over reinforce the behavior either, because if we do, it's teaching them that this is a healthy and appropriate way to get the attention that they're looking for and that validation that you're going to be there. So let's talk about some solutions. In the comment section, I'd love for you to go down and comment what you think your child is driving towards. Do you think that they have a sensory integration disorder? Do you think that they are a person whose dial is turned way up and so they genuinely feel pain in a way that you do not? Do you see other signs of that? Or do you think, man, oh man, nope, they're holding me hostage. They're attention seeking and I don't know what to do with this. What have you been doing and what's not working? If we come together as a community, it'll help us to understand, one, that we're not alone in the battlefield, and two, that other people are navigating these waters and how they're navigating those waters. So let's look at the first one. Hypersensitive to touch, gravity, pain sensations. If this describes a child that you are raising, a child that you know, the number one thing that you can do to help them is to work on recalibrating their system. Because guess what? Even though for you, you're like, that is a tiny injury, I don't get it. The pain is genuinely an 8 out of 10 for them. It's genuinely higher. And so if you had that kind of pain, how would you want somebody to respond? Invalidation. Definitely meeting the needs, right? Putting ice on the boo-boo, making sure that we're covering the raw skin that's sensitive to the airflow, right? Putting some Neosporin on that, covering it with a Band-Aid, doing the best that we can, all the things that you're probably already doing, but you're doing it like, gosh, am I crazy for this? But what we want to do as we're meeting those medical needs and as we're validating those pain signals is recalibrate the system. How do we do that? It's actually by retraining the brain to feel. And a lot of the things that we do for that are joint compression. So I have another video where we talk about joint compressions, but you can certainly Google joint compressions for children and look that up and then follow the video done by physical therapists in your own home. Brushing. Corn brushes are something that a lot of physical therapists, occupational therapists will use to be able to integrate that body-brain connection and get those signals kind of turned on. You got to remember, if we've got a high sensitivity to pain, we definitely want to go easy, but those regular inputs will help your child's system to recalibrate and reintegrate. All of those sensory things, right? All of the sensory fidgets, all of the rice tables, water tables, all of those kinds of things are really, really good. And time. I know that I've had a child that was super, super hypersensitive. She's still hypersensitive, has some diagnoses to go with the reasons behind that. But as she has matured and her brain has grown, her sensitivity has definitely died down. I have another kiddo that's a tween right now who's got a little bit of that still happening, right? And so we do work on giving some of those squishies, right? Those nice tight burrito rolls where we wrap the blankets in, where we do some of that taco swings, fold a blanket in half with the kiddo inside, mom and dad gently rocking that swing side to side, giving the inputs where we can to help continue to develop the body and the brain connection in ways that are healthy and appropriate that can get your kiddos to stabilize. And I can tell you, I worked with the OTs with my kiddos for years, and it does make a difference over a course of time. So if you're already working with an OT or a physical therapist in those arenas, keep up the good work. And if you're not, oftentimes just having a sensory issue is not enough to qualify you for services. So you're going to want to search those things up or reach out to me, and I'll be happy to give you some of those resources so that you can implement those things at home because they do make a difference. They absolutely do. Wobble seats. That's another really, really good one to help kiddos that are struggling with that. So you can look up those too. Okay, now attention seeking. You're like, Brooke, what do we do when it's all about attention and it's all about control? It feels manipulative. I'm resenting having to do this. And yet I want my child to feel loved, supported, and connected. If that's you, let's take a look at the best approach. What we want to do is absolutely pour into our child so that our child recognizes that they're right. If they do have pain, if they do have sickness, you are going to be there. You are going to show up for them. But we also don't want to reinforce false claims, right? And so this is the advice that I would give. It has certainly helped in my home, and it has helped in so many of my clients' homes. So hopefully this will be a help to you. Let's give a scenario. The scenario could be a headache. And let's do an age of, let's say 11 years old. Okay, child, 11 years old. Oh, mom, my head just really, really, really hurts. It would look like a gushing of concern. Wow. Oh, no, sweetheart. I'm so sorry to hear that you have a headache today. What do you think caused that? Do you think you're dehydrated? Do you think you've been running too much and just too much motion? Or are we just maybe coming down with something? Oh gosh, I'm so sorry to hear that that's happening for you. Well, here's the thing in our family, we want to use the least invasive measures possible in order to take care of that headache. Meaning, we don't want to dose our kid up with Tylenol, right? If our child's not needing it, there's some negative consequences to chronically being on pain relievers. And so we don't want to encourage that. From there, we would say, you know what? I think what I need to do with you, sweetheart, is come with me. Come with me. Come here, sweetie. Right? Give them a hug. If you're a praying family, pray over them. Then escort your child to the freezer and grab a boo-boo bag or an ice pack. Oh, sweetheart, come here, come here. And then take your child to their bedroom, lay them in the bed and let them know that you don't want them to strain their eyes, further inducing a headache. So we're not going to have any tech or lights in our room right now. We're going to use that cold compress on their head. We're just going to rest and remove all the things that could cause strain for that headache. Right? And so the child is going to end up in their room in the dark with an ice pack on their head, incapable of capturing your attention, right? If the child, mom, oh, yeah, no, honey, I need you to just rest and I need you to drink water because it could be dehydration. We want to go ahead and treat that symptom. It's my job to take care of you and to make sure that you're okay. And I know that that's your body needs rest. Your brain needs rest. So rest your eyes and rest your head. I'll be out here so that you can rest. So your child's desire is to get your attention. And ultimately, your child's being removed from you, not getting the attention, but all of your affirmations of care, concern, validation are 100% there. Validating that your child matters, that your priority is making sure that they're okay, that you are all on board for every homeopathic method to be able to treat that headache. Make sense? Okay, so then let's use another example. Another example would be a child falls and scrapes their knee. Their knee is barely scraped. They are not a person who's hypersensitive, right? And so you know that on a scale of 1 to 10, maybe it's a 10 for 2 minutes. And then in all reality, we put a Band-Aid on that sucker and most kids are fine. They're right back to playing, but not in this case, right? This child, oh, mommy. And they're following you around. Mommy, my leg. Guys, it's the same kind of thing. What we want to do is that, oh my goodness, are you telling me that it's hurt more than just the skinned knee? Caveat, guys, remember, if there's a chance this child has a broken leg, right? Like, please don't come at me. Like, that's so insensitive. You're not considering. I'm telling you, consider that there could be something more. But when there isn't something more, and it's attention seeking, what we need to do is grab that boo-boo bat and limit the activity and the attention. Allow the child to rest. Let them know. Tell them, I love you. And if you've got something going on here, we need to make sure that you're okay. I love you. And I would never want to put you in a situation where your owie is getting worse. So we need to lay on the sofa and just lay there and elevate your leg and put an ice pack on it while mommy takes care of cooking dinner tonight. Okay. So you just stay there. You're going to be okay. Let's give it some time. And again, pray over them, love on them, walk away, give them their drink, give them their ice pack, and walk away and allow them the opportunity to feel like, gosh, this isn't as much fun as playing. This isn't as much attention as if I sought the attention in healthy and appropriate ways. Right. And then lastly, what we want to do is make sure that we are affirming our children when they do seek attention in healthy and appropriate ways. When they're doing it in unhealthy ways, it tells you they're looking for their cup to be filled up. Another video that I've done before is the bottomless, the bottomless pit, right? It's the black hole child that sucks for attention 24 hours a day, 7 days a week. We have those kiddos. And so this may be one of their ways, and it may be the bottomless, where it doesn't matter how much attention you give, they're still seeking it, right? Because they're not rooted in themselves. So they're looking to you to affirm them all of the time. That's a whole nother subject. But what we do want to do is teach them that, hey, listen, one, you can do this on your own, right? In life. That I don't need to validate your importance and your significance. You are important and significant unto yourself. But two, that when you come to me with healthy and appropriate ways, give them the verbiage even. Would you like a hug? I think that might be what you're asking for. Do you like a hug? Okay, let's do that. Let's ask for a hug instead. And then give them that hug. Oh, yeah, you used your words and you asked for a hug. And here you can get that, right? When we do that in healthy ways. So teach them, give them the verbiage, give them the affirmations when they do it appropriately, so that hopefully your child's need for inappropriate ways to seek that affection and attention will be reduced. I know I packed a lot into this video today, but if you are interested in more tips for your adoptive child, please hit subscribe and check out what it is that we're doing on the Facebook page. I have a ton of information on Facebook. I post there multiple times a day, sometimes for your benefit. And so find me at Brooke Fremouw on Facebook. I also, thetraumamama.com is where you can enroll in Journey University, where I give you tools and systems to be able to take the chaos that's in your hearts and in your homes, and exchange them for peace, where we can start to calm down the neurological pendulum swings that exist for our trauma kiddos. God bless you guys. Thank you for your time and attention.